Hello, this is our presentation on Trisomy 21, also known as Down syndrome. What is Down syndrome? The human body contains 46 chromosomes, in which 23 are inherited from both mother and father. In the case of Down syndrome, there is an additional, either full or partial, chromosome 21, resulting in 3 copies. There are 3 distinctive types of Down syndrome. The most common, trisomy 21, affects approximately 95% of cases. Translocation, which is when a child only has an extra part of chromosome 21. There are still 46 total chromosomes, however, one of the additional pieces of chromosome 21 is attached, affects 4%. And mosaicism is when a child is born with an extra chromosome in some of, but not all of their cells, affects only 1%. Down syndrome affects approximately 6,000 infants annually in the United States, making it the most prevalent chromosomal disorder affecting children, and Down syndrome is a genetic condition. There is no cure. Some physical traits of a person with Down syndrome include low muscle tone, small stature, flat face with upward slanted eyes, protruding tongue, brush-filled spots, which are white spots in the iris of the eye, abnormal shaped ears, and a single deep crease in the center of the palm. Some testing for Down syndrome. Prenatal screening only identifies the chances of the fetus having Down syndrome. Diagnostic testing includes an amniocentesis after the 15th week of pregnancy, chronic villus sampling between the 9th and 14th week of pregnancy, percutaneous umbilical blood sampling after the 18th week of pregnancy, and chromosomal interpretation to confirm the diagnosis is done at birth. Some risk factors for Down syndrome include the maternal age over 35 years old, another child with Down syndrome, or a parent who possesses the translocation gene. Possible health problems of a child with Down syndrome include the tetralogy of Fallot, which is a ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta, patent ductus arteriosus, tracheoesophageal fistula, duodenal atresia, and a perforate anus. Hypothyroidism, chronic serous otitis media, ophthalmic problems, seizures, increased risk of dementia, and mild to moderate IQs. Cognitive impairment is always a factor with people with Down syndrome, but they are still able to attend school, work, have purposeful relationships, and be an important part of society. Some nursing considerations to take into account: take time to talk to the parents about their child with Down syndrome. They exceed in social skills, but they will need occupational, physical, and speech therapy. And also find some developmental therapeutic activities that are appropriate for them. Life expectancy. The life expectancy of people with Down syndrome has improved greatly in recent years due to advancement in medical technology, especially in corrective heart surgeries. The average person with Down syndrome tends to live 60 years or older. A possible nursing diagnosis for an individual with Down syndrome would be delayed growth and development related to a genetic disorder, as evidenced by abnormal number of chromosomes, low IQ, and heart abnormalities. Some possible nursing interventions for this diagnosis would be to provide support and education to parents of infants with developmental disabilities. The rationale would be that parents should expect to see moderate to significant delays in reaching developmental milestones. Another intervention would be to assess expectant parents for risk factors that can cause developmental disorders in children. The rationale would be that early detection of risk factors can help prepare the parents for possible developmental disorders, and also to monitor the height, weight, and nutritional status. The rationale would be for some developmental disorders may cause delays in growth and nutrition. A possible outcome for this diagnosis would be parents will verbalize understanding of potential impediments to normal development and demonstrate actions or environmental or lifestyle changes necessary to provide appropriate care in a safe, nurturing environment. In CLEX question number 1, The answer is B. Due to faulty meiosis during conception, a third copy of chromosome 21 is created, which is what contributes to trisomy 21. NCLEX question number 2. The answer is A, B, and D. An ultrasound can only show possibilities of abnormalities. Amniocentesis after 15 weeks, chronic villus sampling, which is between 9th and 14th weeks, and a blood test of the umbilicus after the 18th week can all be done to confirm Down syndrome, trisomy 21.